Hi, my name is Joanne Sincero. I work with the Community Health Department. Um, Back in March 2020, I was put on a project with a number of other colleagues of making patient engagement calls to a ginormous list of a lot of our vulnerable patients. In the beginning, we started off mainly checking to make sure people had food, water, medication resources, whether they could access telehealth. Um, and as things shifted and the vaccine came out, we shifted to making sure that we were providing equitable access to the vaccine, and not just to people who had the ability to, be to the front of the line. I feel really proud of the work that we did in terms of making sure that our most vulnerable patients were at the front of the line instead of the back. Um, and you know, I there was one patient in particular I comes to mind early on when the vaccine first came out, and he was so afraid, but knew that he's like, I know I need to do this, but just talk me through it. Just talk me through it. And one of the things he shared was he was afraid that he was going to grow a tail, um, and fear is not rational. And we were able to talk about the risks rewards. By the end of the conversation, he said, uh, well, we determined, well, if you do grow a tail, there's going to be a lot of people with tails. Maybe it'll be useful, or there'll be a treatment for the tail. So he did eventually get the vaccine, but one big takeaway for me from all of this, there'll be many more, I'm sure. um, it was that the trust and relationships that Whitman-Walker staff have built over the years, had we not had that when this pandemic started, we wouldn't have been able to make these calls. We wouldn't have been able to do this project at all. When that 7,457,000 number popped up on their phone, people wouldn't have answered. And it gave me personally a lot of ease and confidence to be able to cold call people and know that people were going to listen to something I had to say. So thanks for listening.